Prepare to experience the strongest radio allowable by law. Secrets will be revealed. Myths dispelled. From the studio gym where excuses never apply, it's Superhuman Radio with your host, Carl Lenore.
Hey, welcome back to another episode of Superhuman Radio. We have a really good show planned for you today. During the first hour, we're going to be providing an installment of the pep talk. We're going to talk about BPC-157 being used intra-articularly in the joint and what that might provide for people who have knee problems. Later in the show, we're going to be joined by a representative from BetterHelp. One of the things to come out of this pandemic has been telemedicine, and now the mental health community has their telemedicine answer. We're going to talk about that for people who need help at home. Before we do any of that, we have to thank our title sponsor, and that's Legendary Foods, makers of the tasty pastry. But don't forget their flavored nut butters, their seasoned almonds. These are all fantastic snacks for you and your family. Legendary specializes in 0 to low sugar content in all of their products. The tasty pastry is an example of that. Less than 1 gram of sugar. You'll think you're actually eating a pastry. It tastes like it, feels like it, smells like it. The only thing it isn't like a real pastry is the amount of carbohydrates and sugar. Less than 1 gram of sugar, a total of 5 grams of net carbs, and 20 grams of high quality protein. You'll feel like you're cheating, but you're not. Go to shrnetwork.biz/legendary. Use the code SHR10 and try them today. And then, of course, as always, if you listen during the commercial breaks and you hear the secret word, email the secret word to onair@superhumanradio.net. Include your mailing address and we'll send you a box. And be patient because I am the one responsible for harvesting your address from the emails and forwarding them on to Legendary. And I haven't been doing a very good job of that, but I am going to catch up with everybody this weekend. So some of you will be getting your tasty pastries next week. So don't forget about that. And then, of course, Legendary Foods is a fantastic company because they provide such great support to this show. So show them some love. And now, without further delay, I invite Dr. Edwin Lee to the show. How you doing, Dr. Lee?
Hey, doing great.
So before we do anything, you want to make a disclosure just in case people think we're making medical claims and advice, right?
Yes. Thank you again. I'm so excited to be with you today. So I'd like to read this disclaimer. As a medical professional, I'm here to share my opinion and hands-on experience. I'm not here to make any claims about a specific treatment, product, or protocol. This podcast is provided as a general guideline and for informational purpose only. The information is not intended to replace medical advice by other physicians. Readers and viewers are encouraged to confirm the information provided with other sources. I make no claim that peptides will cure or treat any condition. The peptides that I will discuss are not FDA approved and was done under an experimental study.
Okay. Now that we've paid homage to the powers that be, let's talk about the science for a second. So you recently published a paper looking at intra-articular BPC-157 injections for knee pain. Now, this fits nicely with a show that I did in 2013 with the now retired Dr. Alan Dunn, who was actually doing intra-articular growth hormone injections to regrow cartilage. Talk about your study. How is your study designed?
So, Carl, this was a retrospective study, and so I did a chart review that for the year 2019, 2020, when I injected peptides into BPC-157 thymosin beta-4. So the patients that came to see me in my wellness center, they basically did not want to have surgery. They were in a lot of pain, and they tried everything underneath the sun. And they said, "Look, I'll sign up for this experimental research project that you're doing." So they basically realized this is a non-FDA approved peptide, and that it may help with their knee pain. So they basically, some of them had MRI of their knee or X-ray of their knee. Some had a diagnosis. Some they just had this knee pain. So I had 17 patients in the study, but we only can follow up with 16. And anyway, out of the 16, 12 of them were just BPC-157, because I was just curious if BPC-157 would just do its job. And 4 of them initially were both a combination of thymosin beta-4 and BPC-157. So out of the 16 patients that we followed up, 14 out of 16 subjectively had significant improvement of knee pain. They were able to move better. They were able to sleep better. They didn't have any issue with movement. There was no follow-up with like MRI to see if their cartilage grew or their ACL repaired or anything like that. We just did just a subjective follow-up. So this is the first, I'm proud to say, the first human clinical publication on BPC-157 in humans. I mean, all the other studies have been in animals.
Why the thymosin beta-4? I understand the body protection complex, the BPC-157, because it has a history of allowing people to heal injuries like bursitis and tendinitis and other injuries. But what value did the thymosin beta-4 have in this project?
Well, Carl, I understand you've been using peptides for a while, but when I started using, I was kind of new at this, and anecdotal data. A lot of people were saying the combination of thymosin beta-4 and BPC-157 intra-articular can really help with the healing process, since thymosin beta-4 really can reduce inflammation. It just like turns off the fire there. So the first 4 patients that I did, 3 out of 4 had significant improvement. And after a while, it's like, you know what, let me try just BPC by itself. And so that's how I kind of progressed with the study, was that I just want to see if just BPC-157 would significantly improve. Because if you had 2 peptides and they both improved, which one was it?
Yeah, which one was it? Right.
So that's why it's like kind of like an engineer. It's like, you know what, let me just simplify and just stick to with one. And in the past, I was doing PRP with BPC-157 and also thymosin beta-4 and getting great results. But which was it? Was it the PRP? Was it thymosin beta-4? Was it BPC-157? So eventually I dropped the PRP because it was a little time consuming. I need someone to help to process, to put it in a centrifuge and draw it up. Whereas, the peptides are just much faster, just draw it up and inject. And so I kind of eliminated the PRP and then eventually just stuck to BPC-157. And I was really shocked, like the results that I've seen with BPC-157, especially with ACL tears. It's amazing. MCL tears, ACL tears, so they've done really well. So there are some people who may need something stronger than that. I have a feeling that some people may need some other growth factors to help stimulate it.
So I didn't realize this show was on the calendar for today. Last week, I think it was Tuesday or Wednesday it was Tuesday of last week. I ride my motorcycle. I commute with my motorcycle. Anytime it's not raining and there's no threat of rain, I'll take the bike and I'll go run my errands and I'll come to work and I'll go to the gym and all that sort of stuff. And I have a pretty heavy motorcycle. My bike weighs 787 pounds without any gasoline in it. And when I was coming to a stop sign, a four-way stop, and there was a woman already at the stop sign long before I even got to the intersection. So I assumed that one of the things I hate doing on my motorcycle is having to put my feet down. If I can roll behind a car and use my throttle and my brake and just stay upright, I'll do that. And so I was approaching this corner slowly, thinking since she was already there and she had the right of way, she didn't have to wait for me to get to the intersection and stop. She had plenty of time to just make her left turn. But for some reason, she didn't do it. And so I had no choice but to stop. And I was rolling in such a way that when I stopped, the bike didn't have a lot of momentum. So the bike came down to the left a little bit, and I drove my left foot into the ground to stop it and actually hold it up. And then she rolled and finally left, and then I took off. So later that evening, I noticed that I had this sharp pain when I rolled off the pad of my foot right at the tibia, not in the knee joint, but right at the tibia. And I thought, well, it'll go away, but it didn't go away. And so it's been bothering me up through this morning. Every time and if I'm walking, 80% of the steps are fine, and there's that one step, and it's so sharp. It feels like someone's sticking a knife in my shin. So this morning, I took 5 milligrams of thymosin beta-4. I'm sorry, of BPC-157, and 1 milligram of IGF-1 EC, or mechanical growth factor. Pulled it into a syringe, got right above where the center of the pain is, pulled the skin up, and I injected it. Left a nice little depot there that dissolved and disappeared shortly thereafter. Within 45 minutes, I had no pain in my shin any longer. Now, will it wear off? I don't know. I didn't even think BPC-157 had an analgesic effect. I was just trying to speed the healing process. But I even, when I was home, I said to Elisa, I started jumping on my toes like I was jumping rope. I couldn't get the pain to come back. It was that fast. It worked that fast. Then I saw this show was on the schedule today. I said, this is great. I'm going to ask Dr. Lee what he thinks about that. What do you think happened?
Oh, it's phenomenal. I mean, BPC and your use of IGF-1 or mechanical growth factor basically helps speed up the process because you're using regenerative peptides, and in addition, you're using basically to stimulate the growth hormone to basically turn on your healing process. So if you can reduce inflammation and turn on your fibroblasts to help with the micro tears that you've had, you're going to heal much better. And there was a classic study done on a rat's Achilles. This is like, I remember my son, he basically was on a cross-country running team, and he had an iliotibial band, and he had a flare-up. He couldn't even bend his knee, couldn't even walk. And anyway, I wanted to inject peptides into him, and he said, "You're not going to effing do that." So he's in ninth grade, and now he even curses more. He's in college. But anyway, I had to give a PowerPoint presentation on him. So I showed him here's a rat, here's the Achilles. Basically, you see the skin of the Achilles, and then basically they, transect. They actually isolated the Achilles, and then you see the scalpel, and they cut it. And then you could see there was 2 rats. So the one rat basically got BPC-157 injected in the belly, and within 2 weeks, it basically totally healed the Achilles tendon. The other rat basically got placebo saline, and it didn't do anything. So a lot of theories in terms of how it healed, but there is a receptor site called the F.A.C.E, F.A.C.E, Paxillin, P-A-X-I-L-L-I-N, and basically that it's a tongue twister. Paxillin pathway stimulates more growth hormone receptors on that the injured site, so that when you use the mechanical growth factor or you can stimulate growth hormone, you can actually heal that process faster. So actually, you're kind of advanced. You did something really cool. So that's a great another study that someone else can do and publish.
So should I? Okay, so now I want to follow up with more shots, right? I have plenty of BPC-157. I have plenty of mechanical growth factor. Would I do it every other day? Would I do it every day? What should I do?
Depends on how bad your injury was, but I would do it daily for about 2 weeks, and then after that, you could probably take BPC by mouth, 500 micrograms a day. But if you have the peptide, then I would finish up what you use and inject near that site, and you'll continue to heal. So I would do daily, maybe a little lower of a dose, but definitely daily. That's what I would recommend.
So let's talk about your study now. Let's go back to that. So now you couldn't really do any, what's the term I'm looking for? Arthroscopy on these knees, right? To see what actually changed, right? You didn't do that.
Right. No, I wish that I could have an orthopedic surgeon that basically would like to work with me and to do another study, and we would see only ACL tears or a particular, ruptured ligament or something like that, and just you could see before and after, and you could do MRIs before and after and see the difference. That would be the gold standard test. But I'm in a wellness center, and I have people of all different knee types of pain, whether it's a young person that had an ACL tear or someone had meniscus tear, someone had osteoarthritis is the most common type of pain, especially after 60. So I have a lot of people with severe osteoarthritis and they just have a lot of pain. And so, I mean, some people I had the diagnosis, some people they just had knee pain and they had no imaging study. So it was just a garden variety of knee pain, and they all signed the consent form saying they realize this is not FDA approved. This is all experimental, and we don't know about future side effects. But they all consented, and anyway, the results were impressive. 14 out of 16 had significant improvement. And this is
So
also
Katrina Miller, who's watching live, said she wants to use BPC-157, but her IGF-1 was 227 6 months ago. Now it's 243. I use no HGH and no peptides yet. Is it okay to use? Why is it so high for 62? Why would her IGF-1 levels? Well, dairy, right? I mean, there's a lot of things that'll raise IGF.
Well, IGF-1, what I tell my patients, if you want to improve IGF-1, good sleep and exercise. So sleep and exercise are the top two things to increase growth hormone. And the other thing is that if you use no peptides to increase your IGF-1, who knows what your baseline IGF-1 was when you were like 30 or 20, maybe higher. So you're on the top, like I would say 5% of the population to have IGF-1 without anything, the 220, 240. If it goes higher, I would just be on the lookout for acromegaly. That is a tumor that secretes too much growth hormone and usually presents between 50 to 65, 70. It's slow growing, and if you notice your shoe size is getting bigger, you used to be size 7, now size 8, your rings are getting tighter, you need new rings, I would basically see an endocrinologist for a workup for acromegaly.
Your knuckles are getting bigger. One of the earliest signs of a benign, overactive pituitary adenoma, which is what leads to acromegaly, is the first thing to grow is the cartilage in your joints. You start to look like you have rheumatoid arthritis. You end up with proud joints and pain in your joints too. But let me go back to something else that you said. It's very, very important. First of all, the only way to determine if you make a lot of growth hormone, and that's where your IGF-1 is coming from, is to look at IGF-1 binding protein 3. If IGF-1 binding protein 3 is elevated, then your IGF-1 is a result of your high growth hormone. But eating a lot of dairy will raise IGF-1. This is a fact. In fact, and now we don't know if it's because there's residual IGF-1 in dairy that we absorb, or it's just the result of the high quality proteins. Because don't forget, IGF-1 is a strand of amino acids. And the higher the quality of protein in your diet, the better the body is able to put together these peptides, which are just stranded together amino acids. But the other thing I want to mention is this, Katrina. Epidemiological research leads to new baseline lab assays. So in other words, if the population is predominantly sick and they look at a population of 10,000 people to establish that this is the average high and this is the average low of this population, that average low is shifted down because maybe 30%, 40% of that population is sick. So these lab assays, I don't want to say they're arbitrary numbers, but they're constantly moving. So we are seeing men's testosterone. So when I was first paying attention to testosterone, when I was first powerlifting and I was using steroids, the bottom for men was 460. If your testosterone got below 460, you were clinically hypogonadal. Today it's 320. Quite frankly, women can have as much as 200. So what men is considered low is very close to what women consider high. So the reason I say this is when you look at these lab assays, understand that they don't really know what is normal and what is not. They only know what the average is for a population. And when you account for the number of sick people in a population, what's that old saying? We're driving to the bottom for some reason. We're going, oh no, this has to be lower. It has to be lower because this is where the population is sick and dying. So just keep that. I do take amino acids, she said, and that could be stimulating. Dr. Mark Gordon, who used to be the keynote speaker at A4M for everything growth hormone, talked about ornithine, leucine. I'm trying to think. There was 4 amino acids that when you have adequate amounts, your body will produce more IGF-1. So it could be from your amino acids. That's really what it could be. How you like that? Okay, let's talk more about the study now. So you say these are intra-articular. Were they ultrasound guided, or did you just know, this is a good place to put it?
This was without ultrasound guidance, and basically it was into the knee joint, so intra-articular injection. So you feel there's a special spot that's like a slight indentation on the side of the patella on the right. You can do left side or right side, but it's called a tibial plateau, and the tibia just stops. There's a plateau, and you can just put the needle that way. Directed, you use generally a 25 gauge, 1.5 inch needle, and you could go right into the joint easily. So I don't need ultrasound guidance when I inject into the joint. It's pretty straightforward.
How many injections did the patients get of the BPC and the BPC plus thymosin beta 4?
They all got one injection.
That's it, just one.
One, yes, one.
Oh gosh.
Now, this was with the study. Now, I've had people outside the study, but they signed to be on this peptide, realizing this is not FDA approved, this is experimental. And I have people who I inject, and then maybe a month or 6 weeks later, they go, I'm 90% better, and you inject me again, because they quickly want to be 100%. So anyway, sometimes you have to do 2 or 3 shots. I have had people with just a different joint, like had 12 tears in their shoulders, 6 on each side, and now they're 100% functional. But there, I would have to do 3 different shots, so 3 different times on each shoulder. But anyway, I've seen people improve. So
that's very, very fast. And were the results long acting? So in other words, they got one shot. And how long did you follow them for? 16 months? No.
Some people was like when we called, it was 6 months later. Some people it was a year later. But in general, most people got one shot. Some people, I think there was one person in the study got 2, but that was after 6 months. But because they tweaked it again, they like re-injured it, like they fell on it or something like that. But so generally in 6 months, this is better than a steroid shot too, because steroids, as you know, doesn't regrow the cartilage. It just basically reduces inflammation, and you may get a benefit of 3 months with the steroids at the best. So
yeah, but we all know that when you have a steroid injection, a corticosteroid injection, the probability of you getting worse is there because you're not healing anything. In fact, multiple injections of a corticosteroid into a tendon, for instance, will start the process of
weakening the tendon. Yeah,
tendinosis.
you'll weaken the tendon, and the
Tendinosis. The tendon will actually start to shred.
Exactly. So you don't want to inject in the joint, on the tendon, but you inject near the tendon. But here I can inject with the peptide if like you have a specific tendon and I can see it on ultrasound guidance. I'll inject right there and you can see it. I'm injecting this like in the shoulder, supraspinatus tendon. I can see I'm going in and then inject into the tendon, and basically it'll help it heal faster. But even if you miss the tendon, you're around it, it has its effect. It'll be close enough to get it. So
now, how much of this could actually be? I want to say it's called mesotherapy. When they take a surfactant, it's usually lecithin and saline, and they inject it into soft tissue, like lots of injections, almost like dry needling, and the agitation of the tissue beckons the healing process and revives the healing process to come and finish the job that it failed to finish the first time. Do you think there's any of that, since you're going into the capsule joint with the syringe? Do you think that has any value in this process?
I think it's much more than just stimulating, causing. I try not to. It's like PRP. There are people who like to have a little red blood cell in there to cause a little inflammation. I don't like any red blood cell because I'm trying to reduce inflammation.
Right.
So if I'm trying to help someone's joint, because I've had patients who said, "Oh, I saw that orthopedic doctor down the road, and it was the worst pain ever because he has PRP that's like bright red." We used to do PRP was just basically golden. There was no red. There was no irritation there. So. And his shoulder never improved. So the thing is that, I can see, some people doing a little inflammation, and you can have your body try to basically call everyone to come in to help heal it. But really, BPC-157 is truly anti-inflammatory. So there's no inflammation there. And, just inject there. And it's hard to see because, you have to be in the cell and in that environment to see if there's any inflammation. But most people after 48 hours, 72 hours, they see some improvement. The key is not to exercise or strain anything, or like doing jumping jacks right after you inject.
Right.
You really want it to heal.
Right.
Otherwise, you're going to tear things. So I have people who play ice hockey and they have a shoulder injury, and it's like I inject, and the next night they go play ice hockey again and re-injure it. So they're back in my office again. So you need time to heal. So the answer to that is no, I don't think there's anything. I don't think so.
Okay. Dr. Lee is asking people to sign a petition to save peptides. Unfortunately, not enough people understand or know about peptides. Even if you don't need them now, you may need them someday. So having them available could be a very big deal for you someday. For those of us who've been using peptides, we know the value of these peptides, and we don't want them taken away. Unlike kratom, kratom has been saved by people who were addicted to opioids, who want to get off opioids, and they mounted a campaign, and they got like 500,000 signatures that made the FDA stop the process of trying to get rid of kratom. The problem with peptides is they don't have the platform that something that's going to replace opioids had. So we must make that platform. We must share the word with our friends. We must tell our friends, look, if you go to shrnetwork.biz/save peptides, it will take you all of 2 minutes to put your name in there and sign the petition. There's no one scrutinizing this list. It's not like, oh, they're going to come and get you. This is legitimately an amazing therapy that could change people's lives if there's more exploration, more doctors feel confident that by offering their patients peptides, they're not going to be scrutinized and punished. So it's up to us, the people, to save peptides. Again, go to shrnetwork.biz/save peptides. It'll take you literally 2 minutes. In fact, don't even listen to the commercials and the breaks today, unless you want to win a box of tasty pastries, and go sign the Save Peptide petition. We're going to take one quick commercial break. We'll be right back with more. Stay tuned. Remember those rectangular toaster pastries you used to love when you were a kid? Well, Legendary Foods has just made them better. The new cake-style tasty pastry is like nothing you've ever had before. With 20 grams of high-quality protein and less than 1 gram of sugar, you'll feel like you're cheating, but you're not. Go to shrnetwork.biz/legendary and use the code SHR10 to save 10% off your purchase of tasty pastries. Now available in cookies and cream, red velvet cake, birthday cake, blueberry, strawberry, brown sugar cinnamon, and hot fudge sundae. Go to shrnetwork.biz/legendary and use code SHR10 today. Is there something interfering with your happiness or ability to achieve your goals? BetterHelp can help. They will assess your needs and match you with a licensed therapist. This is not a self-help or crisis line. It's professional counseling done securely online. They have a broad range of experts and are available worldwide without having to wait in an uncomfortable waiting room. Get the help you need and start living a happier life today. Go to shrnetwork.biz/betterhelp. That's better, HELP, and receive 10% off your first month of counseling when you use the code SHR. I need to share with you all a revolutionary new wearable technology called F.A.C.E. F.A.C.E allows you to enjoy the effects of caffeine, alcohol, nicotine, melatonin, and muscle relaxants without actually ingesting anything. Yes, really. They figured out the unique magnetic signature of each of these molecules and recorded them. Just put the F.A.C.E on, choose the signal you want, and it starts projecting the magnetic signature of that molecule that you choose, like coffee for feeling alert. Go to happy.com/SHR. That's HAPBEE.com/SHR to learn more and unlock an $80 discount exclusively for the Superhuman Radio listeners. BPC-157. Hey, this is Carl Lenore. Superhuman Radio is the longest running health, fitness, and anti-aging podcast in the world, going into our 16th year of continuous production. If you have a product that you think would appeal to the Superhuman Nation, we can get you on the air quickly and inexpensively to help promote your brand. Join the ranks of some of the largest and most successful companies in the world who know how great it is to be affiliated with Superhuman Radio. Contact Dan Kapitsky today. That's DAN.KOPITZKE at superhumanradio.net to learn more. Being superhuman means being conscientious about the choices we make. White Oak Pastures is superhuman when it comes to raising livestock. They're committed to animal welfare, land regeneration, and rural revival. They responsibly manage the entire process from the pasture to your doorstep. High quality, pasture raised, great tasting meat from a farm you can trust. Full nose to tail selections. They even have options for your pet. Go to shrnetwork.biz/white oak and use the code superhuman to save 10% off your entire first order.
This is the Superhuman Channel, where brawn and brains finally meet.
Welcome back. This is a fascinating discussion because there's a lot of people with knee pain out there. I would venture to say that at some point in your life, as you age, you will develop knee pain. And if BPC injections could actually solve the problem without any of the nasty effects of corticosteroids or other things, this is magic. This is really, really magic. We have a comment from Peter Kranotakis. I believe he's in Greece, actually, watching the show. He says, I suffer from consistent tibial plateau fractures due to the loss of medial meniscus surgery. I need viscosupplementation every 6 to 8 months, but the symptoms start to increase after 4 months. I do exogenous bone stimulation ultrasound every day, he says. I need this. So what he really needs also is to go and find the show I did with Dr. Alan Dunn. Dr. Dunn was on my show in 2013, and it's actually show number 1274. And Dr. Dunn pioneered intra-articular growth hormone injections to regrow cartilage. We're talking about bone-on-bone knees. Listen to the interview. He says that the blood vessels start to sprout first because VEGF goes up in the presence of growth hormone. And once the blood vessels start to branch out from the bone, the meniscus, the chondrocytes start to sprout. And what he did was one shot a week, 20 IUs of growth hormone right into the capsule joint for 3 weeks in a row. And then he sent people home and they came back 6 months later. And lo and behold, they did something that every orthopedic surgeon says is impossible. And that is they regrew the cartilage in their knee. So if I were you, Peter, I would combine intra-articular growth hormone and BPC-157 and see what magic can happen for your own knees, and then let us know. What do you think about that, Doc?
I think it's fantastic. The mechanism makes sense. You basically have your growth hormone releasing peptide to stimulate growth hormone, and then you have BPC-157. I think combination works beautifully. If it comes to cost, and you had a limit to one, I would just do BPC-157 because it has been shown to stimulate the fibroblasts to make more cartilage. So it's and reduce inflammation and increases the growth hormone receptor sites. So it comes down to a cost, Carl. A lot of people, it's just like, if you had to pick one, which one would you pick? That's, you can argue, A or B, but I like BPC-157.
Yeah, and BPC-157, you can get any doctor to probably inject without the fear of being, chased by the DEA. And, ever since, it's really funny how we let sports dictate medicine today, because athletes use stuff to cheat. Oh, now regular people can't use it to get better. They didn't do that with Ritalin, because I knew baseball players that were taking Ritalin. They were getting prescribed Ritalin for ADHD, but they weren't using it for ADHD. These are pro baseball players. They were using it because it made them faster and made them more responsive and made them, think clearer. They weren't taking it for ADHD, but you don't see anybody coming out and saying, oh, we got to pull all the ADHD drugs because baseball players are abusing them. But for some reason, anabolic steroids and growth hormone, those were the two. And that makes me suspicious when the government does that. When they single something out, it's like, wait a minute, they didn't do that to Ritalin, but they're doing it to this. There's got to be more to this story. So, Doctor, I'm not going to ask you to comment on that because I want you to stay at arm's length from that statement. Dr. Steve Beato's name didn't pop up here, but Dr. Steve Beato is an amazing foot surgeon who helped me a lot with a foot surgery that I had to get. He says, I will use BPC-157 and TB-500 for recalcitrant enthesopathies, painful tendon insertions. I educate my patients on self-administration for 4 weeks, once daily dosing, after more traditional therapies fail. This is time-consuming on my part to inform and educate the patient, but yet I have this therapy. I have yet to have this therapy fail. Proper patient selection is a must also. Any comments?
So I wrote a book here, and it's called The Fountain of Youth with Peptides. So actually, chapter 5 is on BPC-157. So, and then I have a chapter on the thymosin. So it's just educational for my patients to read and understand because they have tons of questions. And I think I did a pretty good job in terms of writing at a level that it's like middle school level, not too deep into science, but it's education. Education is the key, and the thing is that there's only so far conventional medicine can do, and then there's not everyone responds beautifully, and some people don't fit in that square, and some people are outside and they need some alternative therapies. And so this is fantastic. I'm glad this doctor's teaching and educating and helping his patient with using peptides. And hopefully he'll have his patients sign the petition.
So the other thing that shows is that here is a physician who realizes that his patients are intelligent. Most physicians, when you walk in, they think that what they know is so above you that they can't even talk to you. In fact, I don't have those physicians in my life anymore because I only have physicians who respect what I know and I respect what they know. But I remember having physicians who dismissed me. When I started doing the show, it was because I was getting ready to get a pacemaker put in at 39 years old. I had a dysrhythmia. I was 330 pounds. I was a mess. I was the average American. And I saved my own life. And I remember going to a doctor and saying, I'm going to start lifting weights. And I'm not going to say his name. Those of you who've been listening to the show for 16 years, you know his name because I've said it before. And I remember him looking at me and saying, well, just make sure your life insurance is paid up because you don't want to leave your family in a lurch. And the best thing I ever did was start lifting weights. It changed, it reconstructed my heart. My heart got strong. I didn't have the problems. The dysrhythmia went away. I mean, obviously losing weight changed the hemodynamics. But when it's really sad to me, the doctor starts his life just like the rest of us. The difference is the books he's read and the lessons he's learned. But no physician is born with a special brain or special talents. That's why they go to school to learn. And so when doctors look down on their patients, which by the way, I know doctors must hate Google today because patients walk in with studies from NIH and go, well, what about this? Oh my God, they must, their heads explode. Oh, I don't want to have to talk to this idiot about a study that they clearly can't understand, when it's quite the opposite. The people understand the studies. That's why they're carrying them in. So if you have a doctor who dismisses you when you ask a question, find a new doctor. Because you know what? There are bad mechanics, there are bad butchers, there are bad candlestick makers, and there are bad doctors. When the doctor graduates with the lowest grades in his class, they don't call him a bad doctor. They just call him doctor. You just don't know he's a bad doctor. So that's it. Time for doctors to start. Dr. Bieto says, I love to educate patients. And again, his name isn't coming up here. But that's Dr. Steve Bieto. He's in Texas. He's brilliant. He drew out what the foot surgeon had to do to fix my foot. I had one botched surgery that actually, if I didn't have that botched surgery, my foot would be 1.5 inches longer and function much better. Dr. Bieto saved me. He really did. And then Katrina says, welcome to a woman's world of doctors. I know, because women really, they probably, what could you know? Go home and wash clothes and cook your kids dinner and leave me to be the doctor. That's how they treat them, I'm sure. So I want to put the book up for people to be able to get your book, and we'll talk more about the book here for a couple minutes. So the book can be found at shrnetwork.biz/book-lee and shrnetwork.biz/e-book-lee. Obviously, one is a hardcover or a physical book. The other one is a digital copy, and you can get it there. What kind of stuff do you cover in the book, Dr. Lee?
It starts with how to look younger. So I have peptides to stimulate collagen in the face, and in addition, basically that chapter is on GHK copper. Chapter 2 is our cure for baldness. Number 3, getting your libido up, and then chapter 4, basically I think I have on growth hormone releasing peptides, and chapter 5 BPC-157. So there's no particular order. You can go front or back. And Mark Gordon, who you mentioned, is a friend of mine, and I remember calling him and said, "Look, I'm done with writing this book." And he goes, "How many chapters do you have in the book?" I said, "I have, the introduction, 12 chapters, and conclusion." He goes, "Ed, that's not good enough. You need 13." And I was like, what the heck are you talking about?
What's the magic of 13?
And he goes, don't you know? There was a study. He's always quoted this one study that a successful book will always have 13 chapters. And it's like, you got to be kidding me. So I was walking my dog that night, and I came home, and there was one chapter that I didn't want to really write about, and that was AOD 9604.
Yeah.
So I said, you know what, I'm going to write it, make it 13 chapters. And so that was thanks to Mark. He pushed me beyond my exhaustion. And I
to a 13th chapter. That is funny, but that sounds like Mark to me.
But if you call my office, you can just Google me, Dr. Edwin Lee. We'll offer a special price for the paperback book. It's normally $39.95, offer for $20. You just have to pay shipping. And we only ship in the continental U.S. We don't ship out overseas. It's too much paperwork.
Yeah, no, I get it. So the other thing I wanted to bring up here was, let me see here. You have a lecture. You're going to be speaking at an event, and you're offering my audience a 50% off code. So while the event is called the Practical Clinical Skills in Neurology, you're actually there talking on the 9th and 10th, right, about peptides.
Actually, 10th and 11th, correct. So we're going to talk about, I'm speaking with Dr. Luis Martinez. I have 3 brand new talks. I have a whole new talk on to basically peptides for pain. And number 2, the controversy of growth hormone, which is it took me 6 months to do. And then the third one is understanding senescence, really the age, why we age, and senolytic therapy. So Dr. Martinez will be speaking on peptides for athletic performance, peptides. Actually, he'll be talking on immunosenescence, and he'll be talking about nuts and bolts of stem cells and exosomes. Therapy.
I want to talk about senescent cells when we come back from this break, okay?
Sure.
All right, sit tight. We'll be right back.
Okay.
New Mass Pro Synthogen X2 just upped its own legendary game. To distance itself even further from the rest of the pack, Synthogen X2 now has double the key active ingredients. If you've ever wondered what steroid-like recovery feels like, Synthogen X2 delivers. See why others compare it favorably to powerful bodybuilding drugs at synthogen.com. Mass Pro Synthogen. When you train with it, you'll gain with it.
BPC-157. I need to share with you all a revolutionary new wearable technology called F.A.C.E. F.A.C.E allows you to enjoy the effects of caffeine, alcohol, nicotine, melatonin, and muscle relaxants without actually ingesting anything. Yes, really. They figured out the unique magnetic signature of each of these molecules and recorded them. Just put the F.A.C.E on, choose the signal you want, and it starts projecting the magnetic signature of that molecule that you choose, like coffee for feeling alert. Go to happy.com/SHR. That's HAPBEE.com/SHR to learn more and unlock an $80 discount exclusively for the Superhuman Radio listeners. Redcon One's new BAR bar is the ultimate soft-baked protein-packed snack bar, powered by peanut butter. Perfect for while on the go to help curb hunger or sneaky sweet tooth cravings. With 20 grams of protein, use as a meal replacement bar or when you're Redcon One's new BAR bar is the ultimate soft-baked protein-packed snack bar, powered by peanut butter. Perfect for while on the go to help curb hunger or sneaky sweet tooth cravings. With 20 grams of protein, use as a meal replacement bar or when you're in need of a high-protein snack. Eat a Redcon One bar as a midday snack or for fuel before an intense training session. Go to shrnetwork.biz/Redcon1 and use the code SHR25 and save 25% off these delicious bars today. I keep saying the number one killer is insulin resistance. Managing blood sugar is the key to living long and aging well. But we all like to eat starchy carbohydrates and sugars from time to time. How do I manage this? I use a product called Blood Sugar Breakthrough by Bioptimizers. This easy-to-take supplement is the result of numerous tests to find the absolute best formula for maintaining healthy blood sugar. Blood Sugar Breakthrough works to safely lower blood sugar after meals so that you can maintain a healthy weight and redirect carbohydrates to your muscles where they can be burned as energy. This means you'll avoid the worst effects of high blood sugar, like weight gain and advanced aging. while enjoying more stable energy, mental clarity, and fewer cravings. Go to shrnetwork.biz/blood sugar and save 10% with code SHR10 today. I would easily say that I am the hugest proponent you will ever meet to doing anything that will improve the quality of my sleep. And that's because sleep is linked to just about every metabolic disorder we see in our population today. One of the easiest things you can do to improve the quality of your sleep is to get a pillow that can be shaped into the exact form factor that allows you to get your best night's sleep. And that is MyPillow. I've been sleeping with MyPillow for a few years now, and I can tell you that when I have to travel and stay in hotels, I don't get a good night's sleep because I don't have MyPillow with me. Right now, you can save up to 60% off of everything offered to improve the quality of your sleep at shrnetwork.biz/MyPillow when you use the code SHR. Or you can call toll-free 800-889-4938. And remember to use code SHR to save up to 60% off of everything at their website. Hey, this is Carl Lenore. Superhuman Radio is the longest-running health, fitness, and anti-aging podcast in the world, going into our 16th year of continuous production. If you have a product that you think would appeal to the superhuman nation, we can get you on the air quickly and inexpensively to help promote your brand. Join the ranks of some of the largest and most successful companies in the world who know how great it is to be affiliated with Superhuman Radio. Contact Dan Kapitsky today. That's DAN.KOPITZKE at superhumanradio.net to learn more.
This is the Superhuman Channel, where we use oxygen for the power of good.
Welcome back. We have Haesue Joe in the green room. She's going to be joining us after the next commercial break to talk about convenient mental health. Thanks to this pandemic, a lot of people are getting telemedicine. And also thanks to this pandemic, people are more depressed and anxious than ever before. Suicides are up. And there's a way for you to get help sitting at your kitchen table or in your sofa or at your office. And we're going to talk about that in just a minute. Let's talk a little bit about senescent cells. I did my first show in 2006 or 7 that showed that glucose signaling is what switches cells into senescence. What do we know now that we didn't know back then?
Well, a lot of things have changed, but yes, having too much sugar in your diet, insulin resistance, too much stress in our life, nutritional deficiency, all hormonal imbalance, just mitochondrial dysfunction, heavy metals, and the inability to remove toxins, all these to basically senescence. But what we know now is that it's epigenetics. It's really the key. Is I consider this like having trash on your DNA. And the more trash you have on your DNA cannot be read correctly. So the proteins that are supposed to be produced are not coming out correctly. Like if you have the P53 gene that basically codes for to protect you against cancer, it can, and if you have some tumor cells growing, the P53 gene's activated and can get rid of it. And if you're not coding it correctly because you have too much junk on your DNA, then boom, you have these senescent cells that grow, and then you have tumor cells that follow right after that. And it's kind of this big, ugly environment where you just have like bad apple that affects all of the normal cells, and basically inflammation is released, and you have all these senescence, and you can't kill these senescent cells, and it's a one-way path to basically to chronic health, to chronic disease, and to eventually to accelerate the death process. So now there's some new things we could that's been talked about as senolytic therapy, and there's new therapies that's on the horizon, new studies that are being investigated. But anyway, I'm going to be talking about that on that conference. I'll be talking about with senolytic therapy. But I've done a study in my office. It's not published. The data's not back yet, but it's really exciting to see if we can reduce senescence, and also see if there's any improvement on having less trash on your DNA or improve your epigenetics. So I think that's a big thing, is really everything's moving to epigenetics these days.
So Dr. Mikhail Blagascloni has been a guest on my show over the past 8 years when he published the first rapamycin study. I was using rapamycin twice a month. Every other week, I would take 6 milligrams, but my prescription ran out. It's very, very expensive, and I put it on hold for now. What are your thoughts on using these types of senolytics to eradicate?
I'm sorry, what pill were you?
Rapamycin?
Oh, rapamycin? That's technically not an expensive one. There are compound pharmacies that can compound relatively inexpensive.
No, they can't anymore unless they add something to it. When all the compounding pharmacies got slapped on the hands for compounding things that were readily available from major manufacturers, I take 6 milligrams every other week, and 12 tablets cost me $200.
Oh, wow.
And that's from TaylorMade.
I got it. All right. So I haven't.
What are your thoughts on?
I haven't kept up with the cost of rapamycin because I've been doing something different with quercetin and dasatinib.
Quercetin and fisetin?
No, dasatinib, which is a
dasatinib. Yeah, sure. It's a chemo drug.
Yes, it's a chemo drug with quercetin, which is all natural, and just a 3-day therapy per month. And seeing the few patients that I have on, I'm seeing really great results. Actually, something today is really exciting because I just had a diabetic patient tell me he was literally had a blind spot in the right eye, and left eye was always blurry. And since he completed another peptide therapy, his blind spot is gone, and his left eye is 20/20.
What peptides are you using for him?
So we're out of. Actually, it's kind of related to senescence, but it's epithalin.
Oh, sure.
Epithalin, which is very interesting because it's from the pineal gland, and the retina and the pineal gland apparently comes from the same origin. So they have kind of the same receptors, and so they're very interactive there. So
wait, we're getting low on time. So are you doing the traditional 5 milligrams a day for 20 days or 10 milligrams a day for 10 days? How are you administering that epithalin?
5 milligrams every other day for 9 doses, because the way we get it, we only can get 45 milligrams. So just to make it affordable. So instead of 50 milligrams, it's 45 milligrams, and you do it sub-Q every 6 months. So.
Wow, that's exciting. And tell me about the dasatinib and quercetin for a second. How many milligrams of dasatinib?
Let's see. We're using, you know what? Off the top of my mind. Let me look 1 second, because the quercetin we're using 500 milligrams.
Okay.
Let me just 1 second.
And while you're looking for those numbers, and you just do this once a month?
You do it 3 days a month. So you basically do it, let's say September 1st, September 2nd, September 3rd, and you just basically take both of them together. By itself, it does nothing, but together they basically work beautifully. And so there are studies small studies with, it's 50 milligrams, 50. So I just
50 milligrams of dasatinib and 500 milligrams of quercetin 3 days a month.
In a row, yes. So like September 1st, 2nd, 3rd. That somehow, when people hear that, they make up their own protocol, but 3 days in a row. And the only side effect that we've seen is a little headache. So people take it more at nighttime, and some people get no headaches, but some people are very mild. But I think a headache's a good thing. It's really getting rid of the toxins in your body. So the key is really reduce the zombie cells, reduce the senescence. My patients call it the zombie cell killers. It's just easier to say than senolytic.
So we got a couple minutes. I want to go through this list real quick. So again, sign the petition to save peptides. It takes you 2 minutes. Please don't say you're going to do it and not. Do it now. Pause the podcast and go to shrnetwork.biz/save peptides. Even if you don't think you'll ever use peptides in your life, They need to be accessible by people. Number two, the good doctor will be speaking on the 10th and 11th at the Practical Clinical Skills in Neurology. You can get 50% off by using the code 2021LEE, L-E-E. Go to shrnetwork.biz/AARM50off. And then lastly, don't forget his book, so you can be educated. Then you can educate others. If you want the soft cover, it's shrnetwork.biz/book-lee. And if you want the digital version, it's shrnetwork.biz/e-book-lee. And I want to thank you so much for being on the show today, Dr. Lee.
Oh, thank you, Carl. It's been a pleasure. I really appreciate it. And saving peptides is really, it comes down to your basic right to access medical care. And that's being taken away. So it's silently taken away. So you have to stand up and tell your friends and family and spread the word. It's really simple. And once I get 10,000 signatures, I can connect with Senator Rubio or Senator Scott to get going. But I need more signatures. So
we have a minute and a half. Matt Perry says, my 77-year-old dad's knees are very weak and painful from years of basketball and 15 years of not taking care of himself in retirement. He's essentially wheelchair bound because of a weak leg or weak legs. Could oral and injectable BPC kickstart healing so he could start rehab regimen to be able to walk again?
Yes, I would definitely use BPC-157, but like Carl said, you can use other peptides too to stimulate growth hormone. I think that will also help give your chance for your dad to basically, hopefully, to rehab. If it's just his knees, yes, I would basically have someone inject into his knee. I would do injection followed with oral BPC. My mother had meniscus tear. I was totally shocked that she couldn't even move. I flew to Pennsylvania to see her. I injected BPC into her knee, and then I drew up in insulin syringes, about 15 insulin syringes, about 30 units in each syringe, and told her just inject just close to the knee on your thigh, and she did that daily. And then when she was done, I told her just take BPC by mouth. She's like 99% better. She's walking. She has just a little thing, but I have to go back probably to do a second injection. But peptides can help. So hopefully your dad will get better.
Thank you so much, Dr. Lee. Take care.
Sure. Thank you, Carl.
Take care. We're going to take one quick commercial break. When we come back, we're going to shift gears a little bit. We're going to talk about mental health. A lot of people need help. There is a better help out there. Stay tuned. We'll be right back. Being superhuman means being conscientious about the choices we make. White Oak Pastures is superhuman when it comes to raising livestock. They're committed to animal welfare, land regeneration, and rural revival. They responsibly manage the entire process from the pasture to your doorstep. High-quality, pasture-raised, great-tasting meat from a farm you can trust. Full nose-to-tail selections. They even have options for your pet. Go to shrnetwork.biz/whiteoak and use the code SUPERHUMAN to save 10% off your entire first order. Remember those rectangular toaster pastries you used to love when you were a kid? Well, Legendary Foods has just made them better. The new cake-style tasty pastry is like nothing you've ever had before. With 20 grams of high-quality protein and less than 1 gram of sugar, you'll feel like you're cheating, but you're not. Go to shrnetwork.biz/legendary and use the code SHR10 to save 10% off your purchase of tasty pastries. Now available in cookies and cream, red velvet cake, birthday cake, blueberry, strawberry, brown sugar cinnamon, and hot fudge sundae. Go to shrnetwork.biz/legendary and use code SHR10 today. If you've listened to Superhuman Radio for any length of time, you know I'm a big proponent of peptides. One of my favorites is GHKCU, the blue copper peptide. It has the ability to repair and regenerate more youthful expressions of skin cells, reversing the signs of aging. Restore Cell's Stem Cell Awakening Serum, along with their other products, contain potent formulations of blue copper peptide and only the highest quality organic ingredients. Superhuman Radio listeners can now save save 25% site-wide. Buy their complete set and receive a free exfoliating cleanser. Go to shrnetwork.biz/blue and use the code SHR25. That's SHR25. Remodel your skin today. Knoll Creek Hemp Company's Delta 8 soft chews are the premier Delta 8 product on the market today. Knoll Creek's Delta 8 is produced from high-quality hemp-derived CBD oil, and soft chews are manufactured using proprietary nano-emulsification technique that ensures the Delta 8 soft chew will timely deliver the desired effects cleanly and consistently from piece to piece. In a space where at least 70% of the products fail to meet label claims and where most users of conventional hemp products are left disappointed, Knoll Creek's Delta 8 soft chews are a product you can trust. Visit shrnetwork.biz/Delta8. That's DELTA and the number 8 and use the code SHR20 to get 20% off your first order today. BPC-157. I would easily say that I am the hugest proponent you will ever meet to doing anything that will improve the quality of my sleep. And that's because sleep is linked to just about every metabolic disorder we see in our population today. One of the easiest things you can do to improve the quality of your sleep is to get a pillow that can be shaped into the exact form factor that allows you to get your best night's sleep. And that is MyPillow. I've been sleeping with MyPillow for a few years now, and I can tell you that when I have to travel and stay in hotels, I don't get a good night's sleep because I don't have MyPillow with me. Right now, you can save up to 60% off of everything offered to improve the quality of your sleep at shrnetwork.biz/MyPillow when you use the code SHR. Or you can call toll-free 800-889-4938. And remember to use code SHR to save up to 60% off of everything at their website. Is there something interfering with your happiness or ability to achieve your goals? BetterHelp can help. They will assess your needs and match you with a licensed therapist. This is not a self-help or crisis line. It's professional counseling done securely online. They have a broad range of experts and are available worldwide without having to wait in an uncomfortable waiting room. Get the help you need and start living a happier life today. Go to shrnetwork.biz/BetterHelp. That's better, HELP, and receive 10% off your first month of counseling when you use the code SHR.
This is the Superhuman Channel. Evolution just got kicked up a notch.
Welcome back. Welcome back and welcome to the show, Haesue Joe. How are you?
Hi, thank you so much for having me. I'm doing pretty well. How are you?
Good. I love your microphone. It has a really nice, rich sound. So is that the right way to pronounce your first name, Haesue?
Very close. Haesue with a short E sound. And thank you for the microphone. I did not manufacture it myself, but Blue Yeti, folks, if you're interested.
Yeah, it's really got a nice sound to it. So this pandemic has done a couple things. Number one, it's pushed mental health to its edges. We have more suicides today, more depression, more anxiety, more attempted suicides. I was shocked that the rate of attempted suicides has gone through the roof. And quite often, all that's needed is perspective. And by perspective, I mean someone to talk you down, to explain to you that suicide is a long-term solution to a short-term problem.
A permanent solution.
Yes.
A permanent consequence here.
Yeah, no turning back. Exactly. Thank you. But the other thing that this pandemic has done is it's opened the door to telemedicine. Because before this pandemic, there were states that would not allow telemedicine because they wanted to protect the doctors in their state. But now, because people couldn't be seen face to face, we have a whole new world out there for treatment. And mental health is picked up the baton by this app, BetterHelp. Talk about it. Who started it? What was the genesis? Explain.
Yeah, I mean, BetterHelp was founded by my boss. His name's Alon Matas, and the company actually started in 2013. So years before anyone could have predicted what was going to happen in 2020.
Wow.
And telemedicine, the idea of speaking with a healthcare provider over the phone, not being face-to-face in some kind of digital format, this isn't new. It's been around for like 20 years, if not longer than that. You know, I've been speaking with nurses over the phone, nurse practitioners. That is telemedicine. And teletherapy is a little bit newer. I joined the company in 2017, and at that time we were way smaller than we are now. And so, yes, the past year and a half or so has really propelled us forward into this crazy space. And I use crazy because it's chaotic. It's like unprecedented. I know that's a buzzword that we've all been hearing a lot. And the company was started by somebody who had struggled himself to find convenient, accessible care when he himself was a busy professional, juggling job and children, family stuff, and finding that, like, I just don't have time to get over to an office, the commute that's involved and the logistics and trying to schedule with this other person that needs to be in the same place at the same time. He had already been in the entrepreneurial space, and he thought, all this stuff is happening online. A lot of apps are popping up to make people's lives a little bit easier in a sense and make things more accessible to them. Why not bring this service that's so hard to get for myself into a space that a lot of people have access to now? And so that's the beginning stories of BetterHelp. And so, we had been kind of preparing and we had the infrastructure set up. We could not have predicted, like I said, what was about to happen in the past year or so. And we had a lot of users before, and we have even more users now. A lot more therapists have joined the effort also.
So before we talk about the patient side, let's talk about the therapist side. So if someone's listening to my show right now and they are a therapist, and maybe they have an office and a practice, maybe they don't, maybe they're working for another practice, how do they reach out to BetterHelp and make their services available through your app? And what kind of relationship do they have to have with you?
Pretty straightforward. They do need to come to our website and betterhelp.com. That's all you have to remember, betterhelp.com. And you'll look for the space to find counselor jobs, therapist jobs. And you don't just get to sign up and you're in, right? You have to fill out an application that is reviewed by a team. You have to provide us with information so that we can verify your license with your respective governing board. There's also a background check that's conducted at the county, state, and federal level on you, the therapist. And we also conduct a video interview to ensure that the person on the other side is indeed the person that is giving us this licensing information and it matches with a valid ID. Right. So once you've gone through this application process, that does include a clinical vignette challenge. So if you're a therapist, you'll know what I'm talking about. We're just looking to see that you have the foundational knowledge that every therapist should have before you are accepted to join this platform. Once you've gone through this application, which can take anywhere from a couple of days to a couple of weeks, and that really depends on how quickly you get through it, you'll be approved to join as background check is clear and everything looks good on your license, unencumbered, no active disciplinary action or investigation on your license is something we'll be looking for. Once approved, you'll be notified, and then through the click of a button, you can turn on your availability and start accepting clients at that time.
So what about the other side? So I was in therapy as a very young man. When I moved to Las Vegas, I was in my early 20s, and I had the good fortune of realizing I needed some help. Mm-hmm. And I also had the good fortune of meeting a really good therapist. His name was Jerry Katz. And there are things I do today that he taught me. So, people don't realize, like, I think of Jerry Katz often in a given week because of things he taught me to use as coping skills when I'm in a jam. And so there was something that happened between Jerry and I, mm-hmm. called a positive transference, right? Isn't that what it's called?
Yeah, so transference is how you feel about him.
Yeah. Because you like this person, and that's a prerequisite to actually accepting what they're telling you. Does that happen on an app? Can it happen? Because I used your service. I was very happy, and I'll tell my story. But do you find that happens in the app?
Absolutely. And people are using apps to find their spouses. Of course, you can create intimate and deep connection through an app and through texting, through video calls, through phone. It is achievable. And you are right. Going into therapy is entering an intimate relationship. You're talking about things that you probably haven't told other people before. Mm-hmm. You're probably talking about things that you haven't really admitted to yourself before. So you want to feel safe. In fact, you need to feel safe in order to do this. And that safe connection can definitely be fostered. I've seen it happen thousands of times here at BetterHelp. And that's why we continue to be successful in providing this service to folks that otherwise may not have an option.
So I've had 2 sessions now. And at first it was like, well, I've got to use this app because they're a sponsor. But then I realized I have some issues that I want to deal with right now too. So this is a good opportunity. I'm under a lot of stress between this business and another business that I'm launching, and the natural stresses of life and relationships and all that sort of stuff. So I set up a session. It was a 45-minute session, and I came away with 2 new tricks, 2 new arrows in my quiver to deal with when I get stressed out, because I'm probably, no, I was going to say I'm different than other people, but that's when you find out you're exactly like other people. But I keep my stress to myself. I don't go home to Elisa and say, I'm worried about this and I'm worried about that. And it stays in me. And then when I get up in the middle of the night, which I inadvertently always do one time to go make pee-pee, I lay there in bed, and what fills my mind? All the things I'm stressed out about exclusively jump in my head. And I'm like, oh, what about this? And what about that? And I become fearful. You have anxiety, and it ruins my sleep. And so I had a nice discussion, and I've selected 3 things that I can gravitate to easier to displace those thoughts. And I tell myself, look, those problems are going to be there tomorrow. I'll worry about that tomorrow. And that sounds ultra simplistic. People are going to go, oh, come on. But really, your brain takes direction very, very well when you try to give it direction and not let it run on its own. So I was very impressed. And the app is not only easy to use, but it offers a variety. You can do video, you can do text. Maybe it's not convenient. You're sitting somewhere, you can't take a call, you can't make a call, you can't do video. You can actually text in your session. I was fascinated by it. I thought it was so well thought out.
Thank you. Yeah, there's we are trying to meet people where they are. Therapists say this everywhere. It's part of our DNA as a therapist to meet your clients where they are. And in traditional settings, meeting them where they are means maybe they have to take a bus and ride an hour to get to your office and sit in a sterile office environment that they're afraid of or fearful of. They could have had past experiences in their life with authority figures, and coming into office spaces like this is not very safe feeling for them. And that is what we were saying is meeting clients where they are. But really, if you're meeting a client through their phone from the comfort of and privacy of their own home, I think that is really meeting them where they are. And if their comfort level with speaking face to face isn't there yet because they're not sure how to regulate, and that's why they're in therapy to figure out how to do that, messaging is such a good option for a lot of people that refuse to see providers because they have a hard time just speaking to someone and sitting next to somebody and expressing those things. A lot of folks haven't had time or opportunity to learn how to articulate what they're feeling. And sometimes messaging can be that stepping stone to get them to that place where they feel comfortable and safe expressing that stuff out loud.
That's fascinating. I didn't think about it, but I have a funny feeling that because of that wall, if you will, of privacy, when I'm on the phone or I'm texting with you, I'm probably going to be more willing to share things with you than I would if I was sitting across from you, watching your face to see if there's any judgment on your face. And maybe, it just dawned on me. I bet you could probably get a lot more done in shorter time because the person, like for instance, sometimes I'll write Elisa an email because what I want to talk to her, I'm kind of apprehensive about, and I'm afraid that if I'm talking to her face to face, I could say it wrong, or she could become upset, or I could be, but you can't do that when you're reading an email. So sometimes I actually prefer writing an email because I get to say what I want to say without the chance of being, misunderstood. Oh Lord, please don't let me be misunderstood. I don't know if you know. You look a little young, but anyway.
Thank you.
But I wonder if it's actually more efficient, more beneficial that people can communicate this way with their therapist.
That's a really good insight. You're talking about sometimes you're in the headspace to just get it out and have someone see it versus being in the headspace to actually have a conversation with someone. That's a different thing, right? So sometimes writing it out can be cathartic, therapeutic in its own way. Maybe you're not really wanting to talk about it right now, but it's I need you to prep by having all these thoughts and feelings of mine on hand, and then we can talk about it when I feel good to do that. And the other thing you're describing is something I've noticed too. When I've worked in offices, I've worked in clinics, and it's the same thing even when you get into a meeting with your coworkers, right? You sit down, everybody's ready to go, But a lot of times people don't jump into or dive into the meat of the conversation here. You start with the small talk stuff. You have to get situated. How was your weekend? How the kids doing? What's your wife up to? And then like, now we're going to talk about this meeting. And that's very reflective of what I notice when clients are coming to the office. What's happening is everybody is using this other contextual communication to regulate. They're getting into a space where I'm now calm. I feel good. And that does take time. It can take 5 to 10 minutes. And in a 45-minute session, that's like, a good chunk of it. And I do find that folks connecting from home, from the familiarity of their living room, bedroom, wherever they are, a lot of folks just dive in. Like you said, they're ready. They're ready to go because they're regulated, and they're in a safe place that's comfortable, and quiet, secure, private, all of the above.
What does the journal tab do? So if I journal, there's a tab for journal. If I journal, can I allow my therapist to read my journal?
Yes. So as a member, when you sign up, you have a few different features that are available to you when you're unable to speak with your therapist for whatever reason, or maybe you don't really want to talk to them right now. There's a journal feature, and this is private to you. You can enter as many entries every day that you want. You can set up settings to remind you to write if that's something that you are looking for. And on each of the entries, you do have the ability to share that specific post with your therapist, and it'll copy over as a message that you can then send over to them. But you would only share with them what you want to, since everything else is kept private for you.
This makes so much more sense than having to break your day and go somewhere and sit in a room. I mean, this is really convenient for people who probably feel overwhelmed by their lives to begin with.
Mm-hmm.
I think it's fantastic. I didn't realize it's been around since 2013. If you want to give it a try, you can reach out to BetterHelp by going to shrnetwork.biz/BetterHelp, and you'll get 10% off your first month. Plus, they have a quiz there. You take the quiz, and they assess you, and they align you up with a person who fits your needs. Talk about that process. Explain what happens.
So when you come as a prospective client, you come to our website, or you can download the app in App Store, Google Play Store. And to get started, you're going to start answering a series of questions. It's about 30 questions. It's less than that, but I don't remember exactly how many. But these are questions that you might be familiar with if you've been to some kind of healthcare provider before. We're getting a glimpse into your situation now. So it's going to ask, in the past several days or several weeks, your sleep patterns, like how you're eating, your financial status, relationship stuff, alcohol use, a lot of different questions to get this snapshot of who you are. And then that questionnaire is provided to prospective clients to review, and we make matches, hopefully based on the preferences that you put. If you're looking for a female therapist who is a person of color, you'll have the opportunity to mark those things, and we will try our best to match you with somebody that fits that description, as well as specialty areas. If you're working on anxiety or wanting to work on anxiety, we're going to try to find a provider that has that as an area of expertise marked. So the therapists are marking stuff on their end in order to help us make these good matches. And once you're matched, you'll have the ability to send messages with your therapist back and forth through a messaging space. You can also schedule live sessions. So, messaging is more like emails. You can send one off, and your therapist may happen to be sitting there and be able to respond, but most of the time they're not going to respond right away. So if you want to have a real-time conversation, now you can use a scheduling tool that'll be available to you in your account, and you'll be able to book times that your therapist has already said are open. So you don't even have to wait for confirmation that this is going to work for them. You just book a day and time that works for both of you. You agree ahead of time whether it's going to be video, phone, or chat. And even at the time of the session, if your circumstance has changed and you're like, I can't get on video right now, but I still want to talk to you, you can switch over to phone. You can do messaging instead. Those sessions are generally 30 to 45 minutes. So that's something you'll want to talk about with your therapist ahead of time to make sure you're on the same page. Mm-hmm. And then we're human. You talked about transference. Countertransference is the ways that therapists feels about people. We have feelings about each other, towards each other. And if you find that you're not feeling the greatest with this matchup, you have the ability to change therapists as many times as you need to before you find the one that feels like a good fit.
And now that's really good, because that would take an insurmountable amount of time and energy to go and sit down with different therapists until you go, oh, I like this person, I think I'll stay. That could take months.
Right. I mean, the traditional process is, researching various providers in your area. You're pretty limited to where you can get to via transportation.
Right.
You got to check out what's going on with your insurance panel. Are they on it if you're wanting to go through insurance? And then in order to even find that first person, you probably sent out a lot of phone calls, left a lot of voicemails, got a lot of calls back saying they're not taking clients. And so to be seated in this room and realizing this isn't the right person for me and thinking like, oh my God, I have to do that whole process again.
Right.
I think a lot of people actually stop looking and they decide maybe it's just not for me right now. So
the other thing that people like to say about talk therapy, if you want to call it that, is, oh, well, I have friends. Well, your friends are biased. Your friends aren't going to be honest with you. They don't want to hurt your feelings. They're not going to tell you, look, you have a problem you need to work on. They're going to be like, oh, don't worry, hon. It's okay. You'll be fine. You need a person who is objective, that's not emotionally involved in your life, to bounce ideas off of. That's the only way it works, because your friends will inadvertently give you bad advice more often than not, because they care about you. And they're tiptoeing around hurting your feelings. They want to tell you what you want to hear. Isn't that true?
It is funny that you're saying this, because we have an ad campaign running right now, a series of commercials where, people are getting bad advice from their neighbor, their friends, their coworkers, their schoolmates, whatever it is. And then they're sitting there like, I know you're trying to help, but this isn't what I need. So
this isn't what I need to hear.
It's true. Yeah. This thing you said about being objective, like therapists are still people. I do have feelings that will come up in the sessions with my clients. However, I'm objective in the sense of I'm not emotionally invested in our relationship and your life, right? I'm professionally trained actually not to be concerned whether I hurt your feelings or if you're going to hurt mine. That's something that I need to be working on as a professional outside of that space, so that when I come to you, we are there for you. Right? It's not about how I feel and what my thoughts are, what my value systems, and all that stuff is going to influence a lot of things about the way that we communicate. But ultimately, your friends mean well. Your family loves you. These people care, but like you said, they don't want to hurt your feelings, and they're trying to protect the relationship, which is a different kind of dynamic that emerges with people that you care about. They may also not have the right knowledge. They're not professionally trained or educated in the space of treating mental health concerns.
And as Dr. Suzanne Turner points out, you also don't want to burden your friends quite often. So you keep it to yourself and you do nothing with it. What about insurance? If your insurance plan covers mental health, does it cover this?
So we don't bill insurance providers directly. However, I have seen a lot of insurance providers, they're changing their tunes now too, and they want to cover telemental services because what insurance provider doesn't want to pay less for preventative care?
Yeah, right.
So what I am seeing is a lot of folks will reimburse. So you can get an itemized invoice through your settings in your BetterHelp account, and you can submit that as a claim for reimbursement.
You're also a lot less expensive than traditional, at least the ones I've looked at, the therapy sessions. So that's another thing. There's a kind of a inherent discount in this type of an approach. But the other thing I was going to mention was if you have an HSA account where you pay for your doctor's bills with your HSA debit card or credit card, then I guess you could probably pay for your services this way, and I would imagine the insurance company is not going to deny it. They let you. I mean, I pay for supplements with my HSA account.
Right. I think I've bought like Band-Aids. So I think it just it needs to be categorized correctly when it's being charged and the payments going through. And I've definitely seen plenty of folks use their HSA or F.A.C.E to get these things covered also. And, in the event that it's not working for you for whatever reason, I've also seen interactions happening with our member success team where they're helping you figure it out in terms of like connecting with your employer to make sure it's categorized properly and maybe even getting reimbursed for something.
Let me put this back up one more time so that people know where to go. And sometimes maybe you just need 1 or 2 sessions to work out a single problem. The other thing that people think is, talk therapy, you're in there for the rest of your life and nothing ever gets solved. No, if you're not someone who's in crisis and you need, like, I could just use a couple answers for this. I don't want to go to my friends. I don't want to burden them, like Dr. Turner said, or I don't want them to give me stupid advice like the campaign. Okay, so I'm going to book this person. I like this person, and I'm going to give them a shot and see if they can help me with this problem. That's all it takes. You're just looking for, look, I said a long time ago on this show, and I've been saying it for a long time, the new selection pressure is where you get your information from. That's it. It's not famine. It's not ice age. If you get bad information and you make decisions based on bad information, you're going to have bad outcomes. So don't you think if something as serious as your mental well-being deserves to work with a professional to ask questions? I think it does. And here's how you get there. You go to shrnetwork.biz/betterhelp, take the quiz, and get 10% off your first month. Give it a try. Haesue, thank you so much for being here and having a wonderful microphone. I have to tell you, usually it's the opposite way around. I have people that sound like they have cats squealing in the background. So,
I have that too, but I got the noise cancellation. So
good.
Thank you so much for having me.
Yes, it's been fun. Take care.
You too.
And that's it for today. Let me think. Today is Thursday, isn't it? Yeah, I put the garbage out this morning. We were supposed to have a casual Friday tomorrow. I'm working on some computer problems right now. We may have it and we may not. But either way, thanks for being here today. Please share the show. You never know who you're going to help. And we'll see you very, very soon. Take care.